patients get admitted with coma often would need ICU. Now, in simple terms, when we say coma, it just means that the person is deeply unconscious. Now, does somebody being in coma mean anything? Is it always bad? Generally, it is important to understand that when a patient gets unconscious or becomes comatose or goes into coma, it is often a symptom or a manifestation of some other underlying disease. So it's just like saying, I have a fever. So what is the cause of the fever? Fever is a symptom of some illness. So also it is true for coma as well. So coma per se doesn't mean it is bad, but it is important to identify what is the reason for the coma. And if the underlying disease is a reversible one, then of course the patient who comes with coma into the ICU often does get better. So the causes of coma could be something like an infection in the brain, a stroke, a bleed in the brain, or an accident which has an impact on the brain, or it could be due to some problem outside the brain as well, such as metabolic factors, changes in the salt level. It could be due to sometimes kidney failure causing accumulation of waste products. It could be due to liver dysfunction, or it could be due to overwhelming florid infections. It could be due to a whole lot of other diseases, what we call as tropical infections like dengue, malaria, a lot of other infections that we see in the monsoons and the winter seasons. So most of these are reversible problems provided they come to treatment on time and they're given the necessary medical support in the right centers at the right time. So all comas are not bad. Somebody being in coma, of course, does mean that the patient is quite unwell, but many of the time, more than 4 out of 5 times, it's reversible if the underlying disease gets better and responds to treatment. Thank you.